I think you have to hit the 3 buttons more. And then pause. So I'll do that. As you see there, I'm sure many of you have already done this, have put your name in the chat on the right hand, up in the chat box, your name, your organization you're representing. Just makes it a little easier. That's the way we take attendance and keep track of who's participating, et cetera. So hi, everyone. I see some familiar faces. I see Luis Valenzuela as well as with us. Haven't seen you in a while.
How are you?
I'm fine. How are you?
Oh, pretty good.
I see Michele. Hello, Michele. Michele this is her last meeting. Eileen, Karina, hello. Haven't seen you in a while. It's just these people I know. Beryl, welcome. Melissa, hello. People I've spoken to and on the phone, Erica, Analia. Hi there, Eileen. How are you?
Good to be here.
Hello, and Sue Pello's on the phone. Okay. So we're going to begin with, let me get to the next slide here. An update on that community health assessment survey. I do have the data analyst with us, Melissa Bauer. She's super duper at analyzing the data that we collect, and she's going to go through some improvements that we made to the collection survey. And we've analyzed a couple of more questions that we hadn't analyzed in the past, and that's just to be more comprehensive and provide as much information as we possibly can. It has to do with insurance question, and I can't remember I think the other one was I can't remember. It might have been the broadband access question, but anyway, she'll tell you. So she's going to pop on her screen and take you maneuver through the community health assessment survey results, show you what's there, talk about a couple of those new questions that we analyzed, and I'll leave it to you, Melissa.
Great, thank you so much. I'm going to share my screen now so that you can see the full-on report, and I believe these are posted.
Yes.
Okay, so we had a total of 1,143 responses for January through December of 2021 through the SurveyMonkey survey for the community health needs assessment, and primarily we focused on Nassau and Suffolk County, and what we did was just gave you the counts for those, which add to 1096, and the rest were either the respondent did not tell us what county they were from, or some of them in there were Queens. So we gave you a percentage split for that, as well as the rest of what I like to call like patient information or demographic information. So you can see what gender your respondents were, as well as if they had insurance. And then this year we had added the type of insurance that they have. And these are counts from that data. And you can see the new chart there.
Can you see her screen? Yes. Okay.
Good. And we also gave employment counts. We added those this year so that you can see how your respondents answered those questions. As Janine mentioned, we added the chart for reliable internet access. And overwhelmingly, most people do actually have access to that responded to the survey. We've got that education level with all of the answers for that. Race was included, as well as age range, household income, and I believe that was it for the overall charts. And we went ahead and did the same thing specific to Nassau. So you'll see the same graphs specific to Nassau County, who had 213 overall respondents, as well as Suffolk County, who had 883 total respondents. A new tab that we added for this iteration was population information, so that you could see the percentages for the county where you live or the zip code. So you were able to filter these if you'd like to. You can click on them and it'll drill down to the number of respondents and then across the board, which gender, ethnicity, race, etc. Your respondents replied. So you can pull that data for yourself if you'd like to. You can copy it and move it elsewhere, or you can use the charts that are found on one of the first 3 tabs. And filtering, you would just, if you wanted to choose another one, you could do that. If there's 2 zip codes you want, you would hold down control after your subsequent picks, and they would all show up there. And to get back, you can clear the filter up at the top. And again, you can filter only Nassau, and it will only populate your Nassau cases. And if you were to scroll down to the very bottom, it'll give you your overall. Sorry about that. Oh, I took the overalls out of here. So because they're percentages. So I'll show you your overalls on the next patch. So you can see we labeled these PT Q1, Q2. These are the specific questions. So what are your biggest ongoing health concerns in the community where you live? And because we allow respondents to answer up to 3, what we've done is we've weighted these. And what that means is we've kind of spread out the count for them so that the numbers would be appropriate as if 1 per person. So we're going to give you the count of how many respondents you had for each of your areas, as well as the average age of those respondents. And then these would effectively become a count. And so 8 people out of those 48 respondents said that asthma lung disease was the biggest ongoing health concern in the community where they lived. And again, if you scroll down to the bottom, these ones do have the overall counts available so that if you wanted to, you could create a rate for those. And again, they will add up to over 100% because it is a weighted number, a weighted count for those respondents. And we did that for all the questions. So those ongoing health concerns for yourself. And again, you can filter by any of these little boxes that have the blue. So we put in every single one of what I've been calling the demographic information, but it's more than that because it's specific to income or education or health insurance. It's not just race, ethnicity, and gender identity. And so we've also got that prevention from your family, you or your family getting medical treatment, which of the most following is needed to improve the health of your community, as well as what health screenings or education information services are needed in your community. And then finally, where do you get most of your health information? And then what we did was we created a rank for each of Nassau and Suffolk County based on the value of the weighted number of respondents for each of those categories. And so we titered them so that you can see the highest number of respondents for the top 5 answers. And then we gave you the percentage. And then again, they'll add up to more than 100% because we're weighting that number. And then we've given you a rank. And I believe Janine also posted the snapshot sheet of these answers next to each other. So you'll see the Nassau County ranking against the Suffolk County ranking. And I believe that I have that right here, which is in that brief survey report.
Right.
Right. So
yeah, there it is.
And that looks like this here. And it explains the weight for the response in this document as well, so that you can see where we created that or why we created that. And so that's just a very brief walkthrough, but I would love to take any questions if you have any questions or if there's something that you want to look at more in depth. You can either raise your hand or just shout a question out for me.
Melissa, I know I ask you this every time.
Yeah.
Can you do a demonstration of if they were to select a particular question and then a couple of zip codes or
Yep. So say,
so they, because this is the pivot table and this is how you can create customized reports for yourself.
Yep, sure. So if I were in Nassau County and I wanted to look at all the females that answered my questions for all of the zip codes, and I wanted those to be lower income. I could highlight, we'll call these 2 boxes lower income, and look at my count of responses. I can either look at my overall count. So 18 people, 18 females that live in Nassau County with what we're calling lower income answered this question. Their average age is 66. And these are the counts, those weighted counts. But if I wanted to, I can highlight this whole bottom bar. And I'm going to copy it. And it might let me not do that, but yeah. And then I can say, I can create rates for these. So I'm going to go back to it and I'm going to steal that header line so that I know which answer is which. So I can highlight that. And when I create, sorry, it's so weird to do this when you're in a Zoom call because it hides. So I can just type the equals bar in. Shall I do it here? This is the number divided by the denominator. And I can make it a percentage, which I can't reach because we're in Zoom. But this is a percentage. So only 1.28% of those females had asthma or lung disease. And if I wanted to
there wasn't a write-in for this, was there?
Yes, there's always another option on all of these questions.
Did you show that? I'm just curious if we saw that. What were some of the write-ins?
Were there write-ins for that question, Melissa?
Oh, okay, so these are the other answers that came in.
I don't know. Does she hear us? Is she,
Can you hear us, Melissa?
Melissa? don't
I
think
know she has some technical issues sometimes with her audio and her Zoom, but
I asked a question, is Eileen?
Yeah, hi Eileen. I know there is a write-in. I'd have to look at the,
Yeah, I'm just curious what any surprises.
I believe she just showed us them. I'm speaking. Can you see my screen? Melissa says, yes, we can see your screen, but we can't hear you. Okay, she's going to try to call in.
Can you hear me yet?
yeah,
Yes,
now we can hear you.
Okay.
now we can.
Don't know why that happened. But let's go
Mhm.
back. All right, let me know if you lose me again, okay?
Okay.
All right. So what I did was I unhid the all data tab.
Mhm.
And this is what comes directly from SurveyMonkey. So when you look in here, this is your respondent information. So what I did was I looked at the top is the question. And so these are the answers that you're able to retrieve from that.
So the question is, did anybody write anything in?
Yeah. And so that's this other please specify column.
Okay.
And so if I unclick the blanks, we can look and see
Mhm.
these are the answers for that.
The
So-
other write-ins.
Yeah. So, and we would have expected COVID for a lot of
Mhm.
answers. And as you can
Mhm.
see, a lot of people did write COVID-19 in there. At the time we created this report, I did not have access to a set of software called Atlas TI that would allow us to process write-in data. But now that we have that, I believe that the goal is for the next iteration to
Right.
add that other calculation in. So we would be able to do that and you wouldn't have to refer to the raw data to find those.
And the individuals, when they're on our site and they're looking at these results, they can get to the raw data.
Yep. And all you would have to do is right click down here and it says unhide.
Unhide it.
Yep. And then the tab is called all data.
Okay.
Yep.
If you wanted to look at it that way. If somebody wanted to create a chart.
Yep.
Can you quick show how to do that?
Sure. Yep. So that's what I was trying to do before. So
Yeah, I know.
yeah, I'm sorry. I didn't realize I lost Jen. I was chatting away. So we'll take females in Nassau County and we're going to pick what we're going to call the lower income.
Right, so you
what-
select your parameters, so to
Yeah.
speak, of what you want to look at by
Right.
highlighting top and bottom, what
Yep.
it is.
Exactly. And so then, so I know which ones I'm looking at, I'm just going to copy this, this top line so it can tell me where what the data is that I'm looking at
Onto a blank sheet,
onto a blank sheet.
a blank Excel sheet.
Exactly. And then I'm going to copy this data down at the bottom, which are going to be your numbers,
Right,
your counts, your weighted counts. And then I'm going to paste those in there so I can see them. So this becomes my denominator. And then this becomes my numerator. So if I want to look at the rates and put those in a chart, I can say equals, touch the field, click divide
by 18.
by 18. And then that would give me a percent. To keep the denominator, the A2 the same, if you just put a $sign in front of the letter and the number, you can highlight this field and see how my X goes from white to black. I can drag that across
So it does it for all of them.
and it'll give me a rate for everybody. So I can make that happen. And then what I'll do is I'll hold the control key and shift key and highlight that field there. And then I'm gonna do insert a chart. And usually you can get I need the data in there. So we'll highlight that with control and say recommend a chart, and it'll give me a chart. And I can plop it down.
And there's your chart.
Yes.
And
Yep.
that's how you create customized charts and reports.
And if you don't like that bar chart, you can click change chart type and it'll give you other options. Say you want it to be vertical as opposed to horizontal, or you want it to be, this one doesn't really work in line charts, but if there was data for a line chart, you could make that happen. I'm partial to these column charts. So you could do that. And then to change your chart title, you would just highlight it.
Rate of,
Yeah.
whatever you want to call it, rate of, what are we looking at? Rate of
Percent.
percent.
I don't remember which question we did.
It was the one, biggest health concerns.
So percent. Biggest concern.
For low income females, right?
Yep.
So you want to identify it as
Um,
clearly as you can
in Nassau
in
County.
Nassau County. So now you have a very specific chart.
Yep.
And you see that heart disease and stroke is the greatest concern.
Yep.
Followed by cancer, followed by drugs and alcohol, followed by safety.
So, and you can make these make these a percent by making these a percent. And now that I can see it, Zoom
Mhm.
makes things crazy. I can just click percent
Mm-hmm.
and the chart will update to percent
Okay.
that you can see.
And then you just can copy and paste that chart and
Yep.
pop it into a Word document.
Yep. So if I'm on it, if I touch it and right click,
Mm-hmm.
I can hit copy.
Yeah.
And then if you're creating a Word document, you can literally just paste it right in by doing Control V
Yeah.
or right clicking and then hitting paste.
Mm-hmm.
And then you can resize it in here as well. So if you wanted it larger,
Mm-hmm.
if you want these changed, that has to be done back in Excel. Like if you want the words to wrap around,
Right.
anything that happens like that, you would right click in that box and just hit Format Access.
Mm-hmm.
And believe it is one of these. Yeah, so you can change them. If
Mm-hmm.
you wanted it to look like that, we can do
Right.
that. Yep. And you can make them as small or as large as you like.
I learned something new every time you do a demo, Melissa. Thank you so much.
And to be honest, if you don't regularly, well, not regularly, but more often than infrequent, let's put it that way,
Yeah.
work with this data and manipulate it like this, you forget all these little
Yeah,
steps to it. So
absolutely.
the more you work with it, the more nimble you become. And
Yes.
the better you become at extracting the exact data that you need. And that tells the story that you're looking to tell.
Exactly. Exactly.
Because I always learn something too, Melissa, every time you do this.
Oh, I'm
And
so glad.
I am sure that next week I will forget everything you just told me.
But now you have a recording and you can refer to
Right.
it.
And everything, we record all our meetings and we post, did we post the recordings, Brooke? I can't remember.
They're on our website and on our YouTube channel.
And we also do have a tutorial somewhere on our website as to how to create these tables and use a power pivot, which is what this is.
Mhm. Sure.
Okay.
And
So
for
I,
anyone that actually has knowledge with Power Pivot, you will be able to create your own reports using Power Pivot as well. I should mention that. So I'm not sure how many of you are versed in that, but I think it might benefit maybe at least a few people. You can insert a pivot table because the data is available within this document. So all of the
weren't
tables
we
are there.
just using Power Pivot or we were, no, we were just using Excel, right?
We were just using Excel.
Mhm.
So Power Pivot, if you wanted to, you could look into this data.
Mhm.
But that would be for what I would call like a super user. But if
Okay.
if they're
So-
out there, they'll know how to do this and
Right.
they'll know I did leave the data within this document.
Okay, so what we were just doing is very basic Excel
Yes.
manipulation.
Yes.
Okay,
Yep. And then
And-
that,
and
that-
these are copy and pastable as well, right? Those
Yes.
charts that you just showed, all of that?
everything in this whole thing is. So if you
Mhm.
were to highlight this and copy it, you can
Mhm.
put that in your Word doc as well.
Mhm.
Great.
Just can't be pasted over. So you gotta,
Yeah.
so everything's in there. Yep. And you can relabel these anything you like right in here.
Mhm.
You know, however you want to label
Right.
it and it'll
Mhm.
hold it.
Okay.
Sure.
All
Okay.
right. Does anybody have any other questions? All this is, this data, this report, the summary report, the full report, all the data is on our website. It's under data, member services, data assistant, and then you just have to scroll down till you find what you want.
And I'm also going to put it in the chat here, just so
in the chat.
everyone.
Now, why do I have, okay, so anybody else have any other questions for Melissa?
just thank you so much again.
Yes,
Oh.
thanks again, Melissa,
Sure,
for
my pleasure, anytime. And
always
I-
bringing us through this demonstration.
sure, and if anyone needs any help, let Janine know and
Mhm.
we can set something up. And I unfortunately do have to sign off, so if you
Yeah.
do have questions, I'm sure Brooke and Janine will let me know.
Absolutely.
Thank you all
thank-
so much.
Thank
Thank you
you,
again.
Melissa, again.
Take care. Bye-bye.
Take care. Okay. So I'm still looking on the update slide. Is there a reason, am I supposed to be opening up the link to the survey itself? I guess that's why I have it up there.
We can't see your screen yet, so if you want to
Oh.
start sharing again.
Okay, wait a minute. Hold on a minute, I gotta grab this mouse that's running all over the place. Brooke knows she was in here earlier. She saw what my mouse was doing. I can't get it to, hold on a minute. There it is. No. Okay. Okay, we good?
Yes.
Okay. So, I'll just quickly open up the survey. Again, this is also on the site. And here we are. It's linked to the Community Health Assessment Survey in English, and it's also paper-based. You've seen this before.
We can only see the PowerPoint right now, but I'll put the link in the chat to where the surveys are.
Okay. And then we have also on our website, I guess I'd have to go to the website for them to see this, right? Can I do that? I have to open up another window. We have the toolkit that we provide so that you can distribute the survey link and the survey itself. We provide a number of, Brooke, do you want to take over and,
Sure.
all right, so I have to stop sharing because I want them to see that. I want you to see the toolkit where we developed a number of sample posts, other materials that you can use, and you can even ask us, we can co-brand it for you with your logo so that when you send a post out or whatever it might be, it includes your logo as well as ours, if that's what you so choose.
Just give me one moment.
Yeah. And, and as I always say, what the data that we receive is only as good as the data, or the data that we can analyze that comes out is only as good as the data that goes in. So of course, the more distribution and the wider distribution we have and the more individuals who take the survey, the better it is for all of us. And so that is incumbent upon everyone to get that information out there. We certainly push it out for our channels, and of course we ask each of the collaborative members, like if you're holding a health fair or a health screening, or you're some kind of an educational program, we have paper-based surveys. You can use that, or you can provide the link. The paper-based you always send back to us, and we will input and throw that into the Survey Monkey collector for you. So I always emphasize that. Can you pull up this survey?
Oh, sure.
Because this is the survey, right? So this is on Survey Monkey. The same exact thing shows on paper. You can see there the other boxes, Eileen, where you can write in, person can write in what they want if they so choose, and then you saw how you can get to that other information. And then you move to the next, and so on and so forth.
And we also have printed versions as well. Each of these
in the
links.
different languages. We have a large print version as well for those who are visually impaired. Now, where is the toolkit? Is that on here?
So the toolkit is it's a Google Drive,
Okay.
and let me just open that up here. So I'll share the link to this as well in the chat. I'm sorry.
Is there a way that we could put this toolkit on the site? So
Yes, absolutely. You know, it
I
should
think
be.
that would be easier because it would all be in one place.
So I'll link it right under the surveys as well on the
Mhm.
website.
Yeah,
So just to show you how to get there from home, here we are on the home page. You go member resources and then member materials. And if you hit data collection tools, it'll bring you right down to the survey. Okay. And that will, the toolkit will also be on our website today.
okay. All right, any questions about that? We're happy to also work with you to create something original for your audiences if you need that done as well. Just give us a holler and we're happy to do that. Okay, I guess we can move to the next. You're advancing the slides now?
Yes, here we are.
Okay. So I want to give you an update on the Community Health Needs Assessment Work Group that had met from last September through April of this year. And they came together because for the state is to meet the state and federal requirements, mainly the state at this point in time, for the comprehensive community health needs assessment that has to be done every 3 years. And so that's what all this data collection and analysis has been about. And that group had been working with Brooke and I to orchestrate that for the past 6-7 months. Back in April 5th, the group met, looked at all the data, and determined and settled on the 2 state prevention agenda priorities based upon what the data showed that we would work collectively as a group for the next 3-year cycle of the prevention agenda. So in addition to the community health assessment survey referred to as the CHAS, which is sent to individuals, we also sent a similar survey this time around to community-based organization leaders. And we have that report on the site as well. And we're going to just take a quick peek at the results of that.
And once again, I just want to show everyone how to get there from the home
How to get
page.
there,
So
sure.
under member resources, you go data assistant and then view all data resources. And the community-based organization survey results are right here at the top under our data tutorial.
And this is the actual report, and it looks similar to, we set it up similar to the way this is the summary report that we had done, the individual one. And you can see little bit of different answers, right? So what are the biggest problems? The community-based leaders in Nassau County are saying drugs and alcohol, obesity, weight loss, nutrition, eating habits, et cetera. And if you scroll down, you can see some of the other answers. They're feeling that the people in Nassau County have problems accessing care, mainly due to misinformation and health illiteracy concerns, and followed by transportation. No insurance keeps coming up, and we had quite a discussion about that because we have a very good insurance coverage rate on Long Island. But when it says no insurance, unable to pay for health care, I think, at least for the community-based organization leaders, many of them work with illegal, undocumented immigrants, right? So who do not have insurance. And also there's a cohort of individuals who may have insurance, but it's insurance that has very high deductibles. And so coverage doesn't kick in until you spend a lot of money. And that has become a barrier for many people because the premiums are much cheaper for those insurance programs. So people who don't have much income will choose those plans. Lost audio. Nicole Dean lost audio. Somebody also just had oh, it's back. Somebody also just had a question in the chat. What was the question? I just saw it and then.
So where are we handing out these surveys? Are they being mailed to the community or are they all members of the LIHC?
All right, so the way this, this is the community-based organization leader survey you're asking about, or you're asking about the individual survey? You can unmute yourself in both. Okay, so the community-based organization survey goes to initially our list of about 600 organizations with respective leaders at those organizations. We also asked our collaborative members to provide us with names of community-based organization leaders with whom they work closely and asked them to complete the survey. The individual survey is sent out, again, as I had mentioned before, we send out the link, we send out numerous posts and use the media to get the word out about the survey. And we do that from our channels. We ask community partners, hospitals, health departments, community-based organizations, health plans. We distribute this survey in libraries. We ask all of them to also distribute the survey. We do not go door to door, knocking on door to doors. We don't have any staff to do that. We ask that at different events that organizations hold, if it's a health fair, if it's a screening, if it's an educational program, even a support group. We have the paper-based version that can be distributed and collected and sent back to us, and then we will input the data into the SurveyMonkey collector. We do it that way. We ask organizations to pop the link into any e-newsletters that they have, but that's the way it's distributed. If we had more money and more manpower, I would love to be able to do a random phone calling of households and get people to complete it that way, but we don't have that luxury. So it really depends on the cooperation and the efforts of the collaborative members to get those surveys out there and get the data back. Does that answer the question?
Sorry.
Go ahead.
I just wanted to add that the community survey is ongoing at all times. The community-based organization survey was a one-time survey in a finite amount of time that is no longer ongoing. So you can continue to push that community survey though.
Right. Okay, that answers the question.
Great.
All right. So we sent the CV, can a link to that last report be placed in the chat as well?
Sure.
Yeah. So so it was a finite period of time. I think it was December 1st, 2021 to January 15th, 2022. Where we reached out to community-based organization leaders to complete that survey. One of the questions on that survey was, would you be willing to engage in a follow-up, in-depth follow-up interview with a representative from the Long Island Health Collaborative? And we had 25 CBO leaders say yes, they were willing to do that. And then we went through a process of reaching out to those 25 individuals, phone calls and emails, and eventually we were able to get 12, was it 12, I think?
I believe, yeah.
12 to actually set up an appointment and agree to the interview. And then we conducted the interviews. They were recorded through Zoom. We transcribed the recording, used Atlas TI qualitative analysis software to pull out key themes, recurring themes, key words, and then developed a report from that. And that's this report that is also available on the website, but we can also put a link in for this as well. And for the most part, this mirrored what we've been finding in both the CBO quantitative survey analysis and the individual community health assessment survey quantitative analysis. And you can take a look at that here. If we scroll down, we can see the codes that emerged from the text. They're somewhere in the appendix.
Yes.
Question. one of the questions we asked was what social determinants of health. I think we asked them what were the top 2 or 3. I don't even remember anymore. And that's a pie chart showing what rose to the top, and leading is, I'm having a hard time seeing this. What's
I think
the
it's healthcare system here.
healthcare system? And that really has to do with when we spoke to these community-based organization leaders, more so access, like particularly in mental health care, like finding a provider or finding one who's available, not 3 months down the road, finding someone who takes the insurance plan. So that was what we were finding with the healthcare system, that it was not as accessible perhaps as people want it to be or it should be. And that was followed by, what was the second one? I can't know.
Prevention agenda priorities.
No,
We
no,
asked them to
back to
rate.
the first chart.
Oh, sorry.
Number 2, I can't, is it
Food was number 2.
Food, so
Oh,
people-
education number 2.
education and food. People not being, education being that the more literate people are about health needs, the higher education they have, the more likely they are to follow through and engage in healthier behaviors, particularly when they have chronic diseases. So that was that's what was meant by that. Then we also asked them, of the 5 prevention agenda priorities listed on the state site, what 2 were most important to them, or what did they feel were most resonated with the clients they serve. And overwhelmingly it was, we had a split, right? Prevent chronic disease and
And the well-being and
the
prevention.
well-being, right, of which is mental health, substance use disorders, which has been consistent throughout. That has been the 2 priorities that we've been working on for the past 10 years. I like to say we've made some progress. I think the pandemic threw us all for a loop and we fell back a little, and we're all kind of clawing our way back, but we've done, it's been these 2 priorities for quite a long time. So what else? And where are the codes? And these were the codes, right? So when you do a qualitative analysis, it's a grounded theory where the codes emerge, right? The key concepts emerge from reading the text. And it's a little bit of a labor intensive process, because you have to read and you reread, and then you have another coder reading so that you have intercoder reliability. And these were the emerging themes and that came up most predominantly, and these became the codes, which we then had subcodes, right? So we came up with chronic and communicable disease, and then anytime the word cancer or obesity or hypertension or even asthma popped up, it would then be coded under the primary domain or the primary code of chronic communicable disease, and so on and so forth. And then here's the code distribution. I definitely cannot see this. Again, barriers to healthcare, and explained what those barriers were in the opinion of the community-based organization leaders with whom we spoke. Followed by, again, education, which has to do with health literacy, a person's ability to understand instructions as to how to keep themselves healthy, how to follow medication, in that realm. And then programs and services, and that was more making sure that they are the appropriate programs and services available for individuals who need the help. And many of those oftentimes are help with finding affordable foods, like maybe food pantries or food assistance programs. So that's what cropped up in that, for that code. Okay, so we can go back now to if we're going to take a look at the prevention agenda too, if we could pop into that. So all this data, all this analysis going on, and like, why are we all doing this? Well, we're doing this for a couple of reasons. One, because we should do it, and we want to know what our constituents, what our patients and clients are thinking, what their needs are, where gaps are, etc. We're also doing this, at least for the counties and the hospitals, because they have to file, as I said at the start of the meeting, a comprehensive community health needs assessment every 3 years, and one is due this year, 2022, the end of the year. So that's why there's been a lot of activity around this right now. Take care there, Eileen. Good to see you. And also hospitals and counties have to file for the on the federal level for their tax exemption status, right, through the IRS Form 990. And that's every 3 years as well, and that goes by their fiscal year. So that can vary. So just pull up those priorities again.
Are they up there? Can you see them?
Now I can, yes. So
Okay.
as I said, for the state lists 5 priority areas: chronic disease, mental health, women, infants, and children. There's 5 of them. And counties and hospitals are asked to conduct a joint community health needs assessment, which the collaborative has done, right, has done that on their behalf. And then what the data reveal, then that tells us what priorities we need to focus on. And so it's chronic disease, which is not a surprise, and mental health, wellness, substance misuse, whatever they call that particular priority. And then there's focus areas within each of those priority areas. And for the well-being one, I think it's the focus area. Which is it, the focus area 2?
I believe so, yeah.
I believe it's 2, prevent mental and substance use disorders. And there's a variety of goals. You don't have to hit all those goals. You can pick and choose the goals. And then with chronic disease, if we go back up, the focus area, I think we're focusing on physical activity and nutrition, I think, which is the focus area 4. Preventative care management. I think that's the one with, yes, preventative care management, my mistake, preventative care management. So that's all the different programs you offer to help people, educational programs to learn how to count calories, nutrition programs, physical activity programs, whatever it might be. So that's just a quick review of the prevention agenda and how the data that we've collected links back to the priorities that were chosen. Any questions? No, okay. Now, having said all of that, and I had said that there's a report to which community-based organizations, academic partners, our libraries, they're all, this report is useful to all of you as well, because it shows, again, what the needs are, what the barriers are. If you delve into our data, you can look at zip codes near your area, so you get a little more of a fine-tuned picture of the needs and barriers occurring in your immediate area. But the information that we gather and analyze is just as useful to you as it is to the hospitals and the counties. It's just the hospitals and the counties have to take it and then write a report. And I'm in the midst right now of writing a template regional report that the counties and the hospitals can choose to use part of it, not use any of it. And I'm putting together a report, and that I'm a little behind schedule, and I hope to have that by the middle of July. Working on the Nassau County one right now. So that'll be coming soon. Next, I wanted to have, and I hope everyone would join in the discussion. At one point in time, we used to have a variety of work groups. We had a food access group. I called them clusters, core clusters. We had a food access group. We had a physical activity core cluster. We had a behavioral health core cluster. And as we now move out of this pandemic and hopefully can have we're going to do a hybrid model, but hopefully Beryl wants us to repeat the selected priorities. It's chronic disease, the first one. I have them here written down someplace. It's the one about chronic disease, which is the first one,
Yep.
chronic disease. And then the second one is promote well-being and prevent mental and substance use disorders. Okay, somebody put the link to the prevention agenda in the chat. Okay, what was I talking about? I don't remember. Oh, so work groups. So I thought at one point we had these small work groups that really targeted a specific topic area, as I had just mentioned. And I just wanted to throw it out there. We haven't had work groups other than the one to work on the community health needs assessment, which is now is not active because we got past all of that and we selected the priorities. If there's interest in resurrecting some of these, what I call core cluster work groups, and it's just something I wanted to throw out there. Is anybody interested? Does anybody think that's worthwhile to do? And it can be around programming, it can be around data collection, it can be around collaborating with like partners. It's just something to think about. Anybody have any suggestions?
I see some heads nodding. That's great.
Okay, best practices in community education. That's a good one.
Yeah, that's a great.
That's a great idea. Which harkens back to health communications, which is what you're really doing, right? Where we're educating the public. So that's a good one. Anything else? Health literacy, that's another good one. All right, so I might follow up with those two individuals and see if we might not be able to fashion something else out. What about behavioral health? That's a tough nut to crack. We had a group working on that at one point. It was just a small, like these small subgroups. Okay. All right, what's next? What do we got next here?
We have some additional data sources.
Oh, yes, we have more data. Changing daily habits, behavioral health. Oh, yes, changing daily habits, behavioral health. Hardest thing to do. Hardest thing to get people to change habits, to take on a healthier habit. We all know how difficult that is, right? We say, oh yes, we're going to walk every day, and we walk for 3 days, and then we don't walk again. So imagine the populations that we're dealing with in many cases, right? Or perhaps a single mom who has a couple of children, and she works all day, and she knows she's got some hypertension, maybe she's pre-diabetic, and she's been told you need to get some exercise, you need to eat better. Well, she's got the 2 little kids, she's working all day, and the exercising and making sure that she cooks a really healthy meal, if she even has the time or energy, is like very low on the totem pole. So it's very difficult, and we all know this, right? And we've struggled with this year after year after year, to get people to buy into that. And there's all kinds of studies and research on different techniques and ways to approach it, but it's just very, very difficult. But we can't give up on it, because that's what we need to do. So keep that in mind, right? This is all about behavior change. And so your communication and the way you're phrasing or forming programs and the way you're phrasing the ask of people is all important. And that, again, harkens back to the messaging and the communication piece of it. Something I was just up in the chat, it flashed away. It said something about health equity, or
Beryl said that social determinants of health and health equity are emerging topics.
Yes.
Could be a good
And
group.
as you saw, we isolated the social determinants of health when we were speaking to the community-based organization leaders, because we wanted to find, well, which are the ones that seem to be most problematic. And it was the access to healthcare. Economics was up there as well, right? So not having sufficient income is a problem. And everything we do, the social determinants of health, health equity, health disparities, it's woven into everything that the state is doing now, and that they're asking all of organizations, hospitals, county health departments, et cetera, to do as well. And we do that here at the collaborative. Michele says meeting people where they are to engage them in their health. Absolutely true, right? And that, that's, for me, that would be, if I were able to take this survey that I have, if I could have a contingent of students or community health workers, that I could go from community to community, knocking on doors and getting that survey completed, would be much more powerful and effective, right? Because I'm bringing the survey to the people where they are. And so, yes, if we can bring the program to the people where they are through mobile vans, like primary care screening vans, all of those type of projects and programs, you'll have a much greater success rate because you've made it easier.
So Janine,
Yeah,
it's Michele. I hate to interrupt, but the thing is that with Suffolk County, now most of the libraries are going to have loaner program for blood pressure cuffs.
right.
We have Stony Brook students at those libraries,
Yeah.
many of those libraries working with it. We have the Sun River Health in Suffolk County working with us. We have in Nassau County, the Long Island FQHC, Mount Sinai, South
Yeah.
Nassau, etc.
Mhm.
They should all be able to, maybe we need to push them a little bit more to get these surveys out so that we're all working collaboratively and really getting this
Yeah.
information.
Well, I do connect with all of the leaders from those organizations you just mentioned. But again, it's the follow through, right? So it's the survey. I can speak to David Nimiroff at the Federally Qualified Health Center, and he certainly wants to and is happy to distribute the survey. Then it's dependent upon the staff in the actual clinics that remember to distribute it or have the time to even remember to distribute it. So that's ongoing, right? So it's an ongoing conversation that I have with all of these leaders to remind them to push that survey. Anyway, okay, so we have a collaboration in place right now with AARP and the hospitals, where we're holding Talk with a Doc virtual series via Zoom on a variety of chronic disease health topics. And we are collecting data, right? Because everything's data driven, about to gauge knowledge learned. And so we have a pre-survey at the start of the presentation, and it's a very brief presentation, and then a post survey. And we are been collecting that data began I think in the early May, and we're going to end the series the middle of July.
Mid-July.
So
Yes.
that'll be additional data that people can look at. Just again, this just shows if the program is a program successful or not. There are a lot of variables, right? So maybe there were people who attended one program who happened to have a higher level of health literacy, right? So we can't, and so therefore they may show a greater change in knowledge, right? So you can't what's the word I'm looking for? You can't account for every variable out there when you're doing any kind of data collection. So this is we're doing the best we can to provide some semblance of data that people can use. Then finally, we have the library research project, which was a 2-year project that we worked with Stony Brook University and Adelphi University, wherein we went to libraries in Nassau and public libraries in Nassau and Suffolk County, randomly selected. It was voluntary, right? went to the libraries, the researchers went to the libraries and really wanted to find out the different health and social support needs that patrons were presenting to library directors, the staff, the reference librarian, the front desk, etc. And they spoke to those very same people, library director, reference librarian, clerk, front desk clerk, even sometimes the security guard, even the janitor, anybody who had interaction with the public, to see what were the predominant needs that were being presented to them, and how well equipped are the library staff to meet those needs, because they are not social workers, they are not community health workers, they are librarians, right? So so that was a 2-year study, tons of data. It was a qualitative analysis. Again, recorded all the conversations, all de-identified, all kept confidential. This study was in conjunction with the University of Pennsylvania that did something very similar. And we, again, if we scroll down to some of the results, I think this is results. This is, again, primary data that can be used to inform what it is you're doing or not doing in your communities. It was by location, right? So we, as I said, we ended up, I forget how many libraries we actually went to. I think it was like 40 or 50 that eventually decided, that said yes. And we did a ton of interviews, three people at each library. And these were the top concerns. The health needs was mental health, getting exercise, nutrition, opioid use, and personal health. And the social needs were homelessness. That was very much way up there. Again, technology and literacy, English as a second language, unemployment related to economics, and food access. And I was going to just say something else that popped into my head about this. So this was pre-pandemic, right? So the interviews took place pre-pandemic. And then again, we used that same process. It was a grounded theory. The student at the Stony Brook University trained qualitative analysts to go through all the transcripts and find the predominant key themes and codes that emerged. And it is actually the results of that. There's a academic paper that was also written in addition to this summary report that I wrote, that is actually being circulated right now to a variety of peer-reviewed journals. Goes from one to the next, which they are trying to get the results published. So once that happens, I'll have an even more in-depth research to provide, or the results to provide with you. But for now, I have this summary report. So this is available for you as well. This is also on our website. Again, pretty much what was found here aligned with everything else that we were finding. When we see, that's what I want to tell you. We found that in the lower resource libraries, so those in lower, in communities of lower income, the needs were more related to how do I get help applying for insurance? How do I get help finding food stamps? How do I get help filing for unemployment? Those were the predominant needs. Whereas in the higher income communities that were better resourced libraries, the needs were more for enrichment, cooking classes, and yoga classes, and craft making classes for mental health. So that's what we found, and that's what we would expect to find. Although they, everybody overall was generally concerned about mental health. That's why that's at the top there. Okay, so what's next?
Just to show where they can find that from the homepage. If you go under member resources, library research project, it has its own page, and you can download the final report right there. And I'll put this in the chat too.
Okay. And we'll be sending all these reports out when we send the summary of this meeting. So you'll get them that way too.
Mm-hmm.
Is there anything else on the list there?
No, that's our data.
Right, I talked about the ARP collaborative data coming soon. We looked at the library research project. Anybody have any questions about that library research project report, or, ask me anything. I know I went through it fast, and you are going to get a copy of it, but if you want to know more about it, I'm happy to answer any questions. No, okay. We might be wrapping up, right? Oh, yes.
Shortly, yes.
Shortly. Again, as you maybe have seen throughout this presentation, that there's a theme of communication and messaging, right? A lot of it's in how we communicate and how we message what we need individuals to do or not do, as the case may be, right? And we saw that with COVID when we were trying to get people to agree to take vaccination, right? There was all kinds of studies and ways to frame the ask about people getting a vaccination. So we have, through the Nassau Suffolk Hospital Council, through its, Nassau Suffolk Hospital Council and the Suburban Hospital Alliance, which is part of the council, a very, I call it, targeted communications assistance that we can provide. Strategic campaign development specifically for the not-for-profit, social service, public health sectors, for those small organizations that are operating on shoestring budgets or barely have a budget to do any of this. We've done this for many, many years. We certainly can do this at a fraction of the cost of what any commercial agency would charge you. And we've done work for a few clients at this point, so just keep that in mind. It's very, very reasonable. We have a ton of expertise in health communications. We know how to bring in, look at the local data to help inform any communications pieces that we design. It's very much evidence-based, and we look at a lot of research. We just don't willy-nilly come up with slogans and whatnot. So just keep that in mind. So I always throw that up there. And
next, we just want to remind you that we do have 2 upcoming sessions in our Talk with the Doc series that we're collaborating with ARP on. One is Thursday, July 7th, all about arthritis and osteoporosis, and Wednesday, July 13th is all about asthma, bronchitis, and COPD. ARP and the Long Island Herald have also reached out to us to collaborate on a hearing program. I believe it's like National Hearing Month in October. And so that will be coming as well.
And we always find a way, as I said, to collect some kind of data whenever, beyond just the number of people who've attended, right? And that's available for everyone to grab, whether you're writing a grant report or whatever you're doing. A report for your CEO, a report for your marketing director, your strategic department wants some information. All of that, we try to gather that data with some way, shape, or form. We always get data out of everything we do. Yes, you will get a recording of this will be sent out. And it is also available on our website. And I think that's it.
Just wanted to remind you about these 2 upcoming walks we have as well in collaboration with ARP. One is on Saturday, August 11th at Belmont Lake State Park. And one is Saturday, August 13th at 11 a.m. at Jones Beach State Park.
Right, and these are culminating walks that follow the Talk with a Doc series, because they are talking about chronic disease and what is one of the ways to combat and better manage chronic disease. It's physical activity. And the collaborative members have always embraced walking as an walking as a good means of a physical activity. Why? Because most everyone can do it. It's easy to do. You can walk slow, fast, and still get some health benefits. You don't need any special equipment. You can walk if you have a safe neighborhood in your neighborhood, and that's another whole issue. You can walk in your local high school track. You can join walking clubs and walking programs. So we always emphasize walking, and this Walk with a Doc, it's an international program for which the collaborative has a chapter here on Long Island. And we've been holding these walks. We used to do them once a month, but then the pandemic came and everything got thrown off schedule. But we're now holding them at different intervals throughout the year. And these two walks happen to be following the Talk with a Doc series. Dr. Keisha Guerrier, who will lead the walk at Belmont, is a phenomenal primary care physician who has led so many walks for us, really breaks down very complex topics about hypertension and diabetes and whatnot into digestible chunks of information for the average person to understand. It's worth it just to hear her speak for the 5-10 minutes before you go on the walk, if you so choose to go on the walk. And, we ask that you promote this if you want among your constituents and your clients, right, who are trying to better manage their health problems and their health issues. These are free. There's no parking. We got the parking fee waived at both of these parks. And I highly encourage you to yourself, obviously, if you want to join us, it would be great. Or if you could perhaps your clients, your patients, whomever. So those are coming up.
And one last one that's coming
And
up.
this is a good one. At the last minute, Dr. Gregson Piggott, who is the Commissioner of Suffolk County Department of Health, agreed to lead a walk in Kings Park, beginning at the Kings Park Library. It's the Smithtown Library, but the Kings Park building, right? Isn't that
That's
what it
right.
is? On Saturday, a week from this Saturday, the 9th, he's going to take individuals on a walk. He's going to give a little talk about, I think he's going to talk about the pandemic, and that's what I think he's going to talk about. And what we can do to protect ourselves for the surge that I just heard is coming in the fall of another Omicron variant. So we can probably talk about that. And then he's going to lead individuals on a walk in the nearby community. And we also have experts from the New York Coalition for Transportation Safety with us who are going to talk about pedestrian safety tips as we walk along our route. So that's another one you could want to join us, or have maybe individuals that you think would benefit from this to join us. And lastly, last slide.
Our farewell.
Oh, there's no more. Oh, yes. So the last slide. Okay. Michele, are you there?
Yes, I am.
Michele Gervat, show everyone your face.
I'm on.
Okay. Michele, who looks fabulous for her age, we won't tell you what her age is retiring. Today is her last day. There
And
she
this
is.
is Katie.
Hello.
And
Hi,
this is Katie
Katie.
who's taking my place.
Hi, Katie. Oh, happy retirement.
Aw.
Now, Michele has been participating in the collaborative from the very beginning stages, back 2013, and I knew her even before that. She's very much committed to improving the health of Long Islanders. She works for the American Heart Association, so of course her focus is hypertension and heart disease and whatnot. But she's always been a steadfast proponent of anything that any of us can do to reach communities. And you saw she put that in the chat, right? She's always got ideas, and she always has suggestions, and has a wonderful way of expressing those suggestions. She will do anything. She's been a staunch supporter of the collaborative. She's worked on a variety of those core clusters. I think she was on the food cluster. I think she's on the physical activity cluster. She might even been on the behavioral health cluster when we had it. She was instrumental in us and getting everyone in the collaborative way back when to embrace the activity of walking as something that we could all rally around, again, because it's great for lowering blood pressure, improving circulation, all of those things that are great for the heart, but also great for other parts of the body as well. So she's been a great friend to me over the years. We've had many a conversation, both related to health and why we can't get people to want to be healthier. Drives us crazy. We want to change the world, but we haven't figured out how to do it yet. And so she is retiring. I will miss her, although I'm sure she'll still want to be involved in some way, shape, or form. If she gives me her personal email, I'm happy to pop you on anything, and you can attend as a community member, as a member of the public now, right?
Mhm.
And we want to wish her well in her retirement, a very well-deserved retirement. I lost count of the number of grandchildren she have. I know it's in the double digits. And she must be a fantastic grandma, I'm sure, because she's been a fantastic colleague and a fantastic friend.
Thank you.
And I will miss her.
Thank you,
We have
Janine.
the certificate that you will get, but we just
Thank
wanted
you.
to throw it up here.
Thank you. Thank you,
And-
Janine.
Yeah, so if you want to say anything, you're happy to.
I just, it's been a wonderful run. You know, I've enjoyed every bit of it. I have a fantastic job. I'm leaving on a great note. There's a lot of momentum going. And the bottom line is that collaboration is the most important thing that we could do. It's not just one focus. It's not just heart. It's not just diabetes. It's not just cancer. It is all of it is all included in how we're going to make a healthy Long Island. So whatever information you have that you want to share with us, Katie will be on board. She'll be put on this list. I just really think that we can do this. We can definitely make a difference. So, as a matter of fact, Janine, I spoke to Matt Cohen from the Long Island Association and said, you better do something now. So hopefully we could do it.
Yes. Well, so I guess with that, we can conclude the meeting. Oh, Michele. Oh, I'm gonna miss you. Our next meeting is on Thursday, the 29th September, and then one in, we meet quarterly is December. I am toying with the idea of maybe holding it in person in December if everyone is game for that. But again, we'll see what the fall brings with this surge that I hear is coming. So we'll see. But again, thank you everyone for participating this morning. You will get a recording of this meeting, a summary of this meeting. All the materials that you saw on our website. We'll also send copies of those reports to everyone. And Michele, take care. Enjoy your retirement. And keep in
Thank you.
touch.
I'll be in touch, Janine. You're not getting rid of me that easy.
Okay.
I'll be in touch. Okay.
All right.
Thanks
Take
so much.
care, everyone.
Okay.
Sure.
Bye-bye.
Bye-bye.
Everyone have a great day.
Thank you.
Thank you.
Bye.